Hello, and welcome to the Cardiology Podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today.
This episode is about the titled Health Status After Transcatheter Tricuspid Valve Repair in Patients with Severe Tricuspid Regurgitation. This was published in the Journal of the American College of Cardiology in January 2024. The first author is Susan V. Arnold from St. Luke's Mid-America Heart Institute and University of Missouri Kansas City, USA. The Triluminate pivotal trial demonstrated the effectiveness of transcatheter edge-to-edge repair, TEER, for patients with symptomatic severe tricuspid regurgitation, TEER. The study aimed to evaluate TEER compared to medical therapy in such patients. A total of 350 enrollees, with a mean age of 78 years and 56% female, were randomized to either tricuspid valve TEER or usual care, with the TEER group further divided between the first-generation TriClip system and the newer TriClip G4, with 12-month follow-up duration. The study was conducted at 65 centers in the US, Canada, and Europe. The primary outcome, a hierarchical composite of death, tricuspid valve surgery, hospitalization for heart failure, and improvement in quality of life, measured by the Kansas City Cardiomyopathy Questionnaire, favor TEER with 11,348 wins compared to 7,643 wins in the usual care group, win ratio of 1.48, p-value 0.02. Secondary outcomes included a significant reduction in tricuspid regurgitation severity in the TEER group, with 87% having moderate or less severity at 30 days. The change in KCCQ score from baseline to 12 months showed substantial improvement in the TEER group compared to the usual care group, 12.3 versus 0.6, p-value less than 0.001. Major adverse events at 30 days occurred in 1.7% of the TEER group. Health status improvements were notable in the TEER group, with a 10.4-point increase in the KCCQ overall summary score at 12 months. A large improvement in health status, KCCQ-OS more than 20 points, was observed in 42% with TEER compared to 16% with medical therapy, p-value less than 0.001. The study suggested that the health status benefit of TEER could be attributed to the reduction in tricuspid regurgitation. The safety profile of TEER is noteworthy, with a minimal rate of major adverse events at 30 days. Caution is advised in interpreting results, considering the study's execution by highly expert interventionalists, improvements in device design, and careful patient selection. The study represents an incremental advancement, acknowledging the early stage of tricuspid TEER development. The role of tricuspid TEER will be determined over the next 5 years, recognizing the limited options in medical therapy for heart failure patients and the potential of TEER to offer a safe and beneficial alternative. Overall, TEER proved effective in reducing tricuspid regurgitation severity, leading to improvements in symptoms, functional status, and quality of life for patients with symptomatic severe tricuspid regurgitation. Follow-up for the enrolled patients will continue for 5 years, and we will understand more about this technology in the coming years.
Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.